the expert voices, it's appropriate now that I invite the member Niti Aayog, Dr. Vinod Paul, to make a summation.
Honorable Union Minister for Health and Family Welfare, Dr. Harshvardhan Ji, Honorable Union Minister for Tribal Affairs, Shri Arjun Munda Ji, Subramanian Ji, my distinguished colleague with whom we had a great opportunity to work together. I look forward to working even more so. Shri Piramal Ji, Hari, distinguished colleagues, thank you so much for inviting me to this meeting. I want to lend my emotional, personal support to this initiative. Today we are celebrating World Health Day with focus on equity. And today's meeting is a very apt tribute to that effort, commitment to equity, and that also to population which has lagged behind. SDGs are about no one lagging behind, no one left behind. So it's very apt, very appropriate, and I'm so delighted that action has been taken on the report of 2018 that was referred to. I'm so happy that building blocks of way forward have been put together, and we have support from such a great organization, namely the Pyramid Foundation. We have support from UN agencies, we have support from academia, we have support from global philanthropy. It's a great beginning, getting it all together, and thank you, Ministry of Tribal Affairs, for doing this. I, above all, want to say that we look forward to, at Niti Aayog, look forward to working with the entire range of stakeholders and leadership of this initiative, and I congratulate you for launching ANANO, namely the Tribal Health Collaborative today. Congratulations, AIIMS Jodhpur, Dr. Mishra, for wonderful, path-breaking work coming out of a center of excellence, national institution like yours, and to create an example of such a strong, meaningful, evidence-driven, collaborative outreach is truly remarkable. Shows the value system that you are developing and the program that you are developing there. And thank you, Pyramid Foundation, for being a partner. I think the impetus that your partnership will give will perhaps be most critical to the initiative, because you have wonderful people on the ground, very capable people. Niti Aayog has had the privilege of working with your team in aspirational districts. I'm very proud of their work, and I know that when they take it forward, they'll do it the right way. I wish to focus on a few suggestions, a couple of suggestions. Firstly, I think if you have to get one thing right in our regions, let's focus on primary care. I'm not saying anything new, but in the rubric of Ayushman Bharat Health and Wellness Center initiative, comprehensive primary health care, there is something more about the vision, the depth, the accountability of the primary care. It's more than what we normally have thought about. And within that, to incorporate special areas such as sickle cell disease is eminently possible. So I want us to make a commitment that our tribal regions, the scope of the work that we have laid on for us, will have a finite timeline for health and wellness centers adapted to the local priorities, conditions, and the partnerships on the ground. So this should be a very time-bound work, clear. Because by 2022, 150,000 health and wellness centers have to be done. We could be doing that like a biscuit factory, but we could do something very special. Because the connect with tribal health, tribal people, our brothers and sisters in tribal regions, has to be done somewhat different. It is really different. It is different in many ways. Not that there are no differences in other dimensions, rural, urban, one region, another region, this district, that district. But here, there is a special challenge, and we know what those challenges are. So to adapt the health and wellness model to the needs of the tribal people of various regions with further adaptation, I think should be a very important focus, and that needs a bit discussion, needs sitting down on the ground with people and carving it out. And we can do it, and I suggest that keep that in mind, that first and foremost it's about primary care. Second is, I appreciate what you've done by looking at tribal healers and their remedies and so on, but also bring in Ayush together. High level of acceptability, low cost, several good things, several things that get accepted very readily, and particularly in the space of primary health care. And therefore, the way we all will design primary health care will embrace the holistic health. And that will be a great model to create for other places, the rural areas, urban areas, and so on. My second suggestion is that Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which covers practically most tribal people, we must make efforts to connect them as a specific effort. Often there is a problem of even knowing whether I am a beneficiary or not, because they use the SACC database, which has its own problem, more so in the urban area. Can we optimize their access through PMJ for secondary and tertiary? As a priority, it's out there. And a little outreach, little effort, little listing, house to house, whatever, I think will be decisive, because having an entitlement to get hydroxyl operated, or correction for sickle cell disease related issue, or for that matter, a gynecological problem or cancer. Technically, PMJ covers everything except cosmetic surgery, Botox, and transplant. Why we are not able to connect these people? Most, and I guess maybe 70% people will be beneficiaries in this case. If we can do it, it's just a bridging thing. And therefore, I would say that should be seen as a very early effort that we all do together, and particularly when UN is connected with us, NGOs are connected with us. Something that we must do very, very effectively. I look upon sickle cell related work to be a very special effort. Very special. It is so painful to see these patients. It's misery. And as Dr. Sachdev said, we have not done enough. And I think in that space, one is to make sure, and I stand corrected if I don't know, whether we have the primary care guidelines for sickle cell disease, for health and wellness centers or whatever in the primary healthcare system. If we don't, we develop them. If we have, we make sure that we implement, and if they need improvement, we do so in this initiative. Because we talk about hypertension, we talk about diabetes, we talk about several other things, but this should be the focus, that India will optimize the management, treatment, care for sickle cell, which is not rocket science, which is about involving people, that rapid diagnosis, and within that, if there is a true problem about not having point of care diagnosis, can we have a mission mode effort to get that diagnostic, which is point of care? You can do optimum diagnosis, do follow-up. In the wake of COVID-19, 96 diagnostic tests from India came up in a matter of about 10 weeks. 10 weeks, 3 months. So if you are bent on creating with your support, with IRAC and other people, let's work together and get a better diagnostic. Why are we waiting? So let this come, but part of this initiative, it must be different from how we have done, in the past, which was well intended. But the past cannot be the future. So the present cannot be the future. It has to be different. So let's focus specially on sickle cell. एक इसको तो कर ही देना, दिखाना ही चाहिए. बाकी बहुत कुछ है, लेकिन एक सफरिंग जो है इतनी यूनिक है, बाकी टीबी का एफर्ट है वो सब कुछ करना है. Last my suggestion is that I think I didn't hear much about demand side and people participation. Now that may be because there is a lot to happen in this seminar. Because what I know about health issues of tribal people, particularly in the space of newborn health and maternal health, I know that their feelings, their understanding, their approach to care seeking, how we need to connect with them is very different. And I urge that we look at that very carefully. Because only supply side issues, saying kar lo, pahunch rahe hain, kar lo, I think the huge gap would remain, and therefore systematic efforts at engaging the tribal people, understanding their own thinking, having the right messages which are acceptable to them, and therefore behavior change people in our team will be very important. People who sit down on the ground with them in the evening will be very important to find solutions. And to connect them to the system is not easy, whatever little I know. And so a change cannot happen if there is no participation, will not happen, more so in this situation, because of other channels being weak or less adaptable to the situation, and therefore I would request that we really think about what we are doing and who the partners for this are. That part, I think, is something that I'm sure is there in the approach, but I'd like to see that much more evident. I also have additional point, which I was overlooked, that the 15th Finance Commission provides for transfer of funds directly to the third layer of our system, governance system. And therefore, those wonderful opportunities of money flowing to the panchayat system are available. And we should be the first ones to use them, create how that money should be spent, create paradigm, how to spend it well. And particularly so for primary care, particularly so for sickle cell disease, would be one additional way of resource utilization. And before anybody else thinks about it, can we do it in this initiative? Because after 15th Finance Commission report, this is one major initiative covering such a large population, and therefore that one opportunity, that switch, that lever that we have, let's use it early, use it effectively, and create a model of how ground level spending on health care has to be done. Last, I just want to again say, EP would stand together. I would personally be very, very happy to be involved. It actually takes away my guilt that I was wondering what happened to that report. Somehow, please read it. And I kept that report on my table and saying, मेरे को इसको शुरू करना है, but I'm seeing that a lot of work has been done under the leadership of the minister, honorable minister and secretary. So it actually, I'm feeling a little light today that agenda is moving well. Building blocks are there, energies are available, partners are there, academia is connected, and therefore I would only say that the role assigned to the NITI Aayog in this context will be played out with vigor, with emotional support, with the full scientific support. Thank you very much for this opportunity.